Here at LifeWorks, we do a lot of what we call integrative oncology. Regular oncology basically has three modalities that they treat people with. There's surgery, there's radiation, and there's high-dose chemotherapy. A lot of patients that we see have been failures for that, or some people are just scared of going through that process, and they've been diagnosed with some kind of cancer. We get people literally from all over the world who come here for integrative oncology, and our approach is very much the same. What is it that underlies it? What are the deficiencies? What can we do to attack their cancer that's different and actually less destructive than the treatments that they've been getting? We do some lab workups, one of which is this thing called the Greek test, where we can send their blood to a laboratory, yes, in Greece, where he can take the tumor stem cells that are circulating around in the blood and do tests on them to find out what kills them. And he tests 50 chemo drugs and he tests 50 natural agents. Regular oncology treats everyone by protocol. The idea of regular oncology is nuclear bomb inside of you and maybe you make it and maybe you don't. What we know from this is if we send this blood for circulating tumor stem cells to see what are they sensitive to, not everybody's the same. So what I'm trying to find out is what is the best thing to do to them, which is also the least destructive. Pretty much everyone knows that high-dose chemotherapy is very hard on bodies. It makes people's immune system go down. The tumor stem cells aren't killed by chemotherapy. So when the oncologist finishes with you and your tumor is shrunk and everybody's celebrating, the thing he's worried about is that there's still circulating tumor cells. You have a high chance of recurrence, and there isn't a good solution to this in normal oncology, except to just give more and keep your fingers crossed. We know they're circulating tumor cells. We know that the regular drugs aren't going to kill them. Vitamin C will kill circulating tumor cells, and so will IV curcumin in some cases, and so will ozone in some cases. And what we're trying to do, it's death by 1,000 cuts. We're not going to kill off your immune system. We're trying to gauge the therapy so that we keep your immune system and we kill as many tumor cells as possible, and we don't make you miserable, and we try to keep your quality of life.